Today's presentation is on Neisseria meningitidis by Addison Elvin. It was first discovered in 1887 by Witch Sailbaum, who had analyzed the cerebrospinal fluid of a patient who had been infected with the disease meningitis. It's been around for 135 years. Meningitis continues to be found all around the world, some places more than others. And fortunately enough, our understanding of this disease has improved exponentially, which has allowed us to incorporate vaccine campaigns, which have reduced several complications. General characteristics include it being prokaryotic, aerobic, facultative, or facultative anaerobe, gram-negative diplococci, non-motile, non-spore forming, and it attacks membranes that protect our spinal cord and brain. Its morphology, it's aerobic gram-negative diplococci, can occur intracellularly or extracellularly in certain types of immune cells. It's fastidious. Its only reservoir are humans, and meningitis outbreaks occur worldwide. However, the highest instances of this disease occur in what's called the meningitis belt, which is Saharan Africa, which on the right, there's a map that highlights that certain meningitis belt. A question to think about is maybe possible reasons as to why Africa experiences the highest risk for meningitis. Its reservoir is the human nasopharynx. Modes of transmission is direct contact of respiratory secretions or saliva, so close contact is required. So like coughing or kissing. Virulence factors, capsule, pili, LOS, human factor H binding proteins, a lot of them have to do with the help of adhesion. That's a lot of their role in the White's pathogenic. Main symptoms of this disease is high fever, stiff neck, severe headache, nausea or vomiting, confusion, difficulty concentrating are the main symptoms, and however, you can experience other ones. This disease incubation period is 3 to 4 days, but can range 1 to 10. Symptoms tend to develop 3 to 7 days. However, recovery can take 2 to 4 days, or if untreated or too severe, it can be fatal. Complications can include brain damage, chronic pain, skin scarring, visual impairment, motor function impairment, and several others. Those are the most common, though. Possible medical treatments, the most common one is antibiotics, and if needed, care in the ICU, and etc. Measures that can be taken to limit the risk of this infection is vaccination, according to health professionals. There are 2 types of meningitis vaccines labeled right here. Both are series, but years following, you'll continue to be administered booster shots. Who's infected? Anyone that comes in contact with an infected individual. However, those vaccinated have a lower risk of being infected. It's estimated that 1.2 million cases occur worldwide. On the right, you can see the graph from years 1970 to 2019 of infected people of meningitis in the United States, and then risk populations would include infants, adolescents, people exposed to crowded environments like college students or military are most common to be infected, and then of course people in the meningitis belt like we talked about, and people with HIV. The reason why Africa experiences the most numbers of meningitis is because it has the most favorable environment, so dry, dusty conditions, travel in large population displacements, and crowded living conditions. My prediction of any future threats of meningitis, I suspect it to improve just because science and research has exponentially improved itself. How